Our study found that patients undergoing minimally invasive surgery, which basically means laparoscopy or robotic surgery, for radical hysterectomy in early-stage cervical cancer have a higher propensity for recurrence and a higher rate of mortality. Traditionally, the radical hysterectomy had been done through an open surgical approach, where typically patients were hospitalized for several days after the surgery, and generally the recovery took anywhere from 4 to 6 weeks. The minimally invasive approach is where the same procedure is done, but only through very small incisions, where patients generally are going home the next day after the surgery, and generally the recovery is much sooner, so typically within 2 to 3 weeks patients are back to their normal functional status. I think it's important for patients to discuss minimally invasive surgery for other types of cancers other than gynecological cancers. Certainly there's differing data as it pertains to different diseases, so therefore it's important for the patient to discuss with their surgeon as to what is the safety of that particular approach for their particular cancer. The results of our study certainly were not expected. The retrospective literature had shown that the minimally invasive approach was equivalent to the open approach. The retrospective literature focused primarily on surgical outcomes around the time of surgery. The retrospective literature did not focus very much on cancer outcomes, and that's critically important. I think it's very important for all patients who are recommended a radical hysterectomy for early-stage cervical cancer to have a very thorough discussion regarding this study with their surgeon, and particularly regarding the cancer-related outcomes.